Hey everyone, welcome to podcast of Medical Microbiology Talks. I'm Abdelrahman, and with me today is my fellow medical student, Boshra.
Hi Abdelrahman. Hiya friends. Today we're diving into an interesting bacterial pathogen called Brucella, which causes brucellosis or undulant fever. It's actually quite fascinating.
Oh yeah, I've been reading about this. It's primarily found in animals, right? Like it's part of their normal gastrointestinal flora?
Exactly. But here's the concerning part. Humans can get infected too, usually through contaminated milk or when they're exposed to it in slaughterhouses.
That's scary. How long does it take for symptoms to show up after exposure?
The incubation period is relatively short, about 1 to 3 weeks. And get this, there are four main species that can infect humans. Brucella, Melitensis brucella, Abortus brucella, Suis, and Brucella canis.
I've heard B. abortus is particularly nasty, right?
Yes, it causes the most severe infections. And here's something interesting. Brucella is considered so dangerous that it's actually classified as a biosafety level 3 organism. Some people even worry about its potential use in bioterrorism.
That's intense. Let's talk about the incubation condition. What makes this organism unique?
Well, it's pretty fascinating from a lab perspective. These bacteria are really slowly growers. They're what we call fastidious organisms. They need specific conditions to grow, like Thayer-Martin agars, and they require 10% CO2 in humidified air.
And it's slowly grower organism, doesn't it?
Yeah, about 3-4 weeks. They're also strict aerobes and gram-negative cocobacilli. When we're trying to identify them, we look for facultative intracellular and cause granuloma and intermittent fever.
What about diagnosis? How do we confirm if someone has brucellosis?
Great question. While serology can give us a presumptive diagnosis, we really need cultures for definitive identification. The confirmation is usually done serologically, and they even use PCR testing to identify specific species. Also, we can use Coombs test for prozone phenomenon.
Wow, this has been really informative. Before we wrap up, any key points you think our listeners should remember?
Yes. Remember that while brucella can be isolated from blood and bone marrow, automated blood culture monitoring systems are recommended for isolation in acute phase. And always take proper precautions when handling samples, because they are transmitted from laboratory.
Thanks, Boshra. And thank you all for listening to today's podcast. Remember the prevention to avoid unpasteurized dairy products to prevent brucellosis and what else?
Stay safe, everyone. Cattle vaccination. See you in the next podcast. Thank you, our friends. Goodbye.